What up, fellas? It's time. Welcome back to the channel where we discuss all things prostate and prostate cancer related. If you're new here, welcome to you. If you've been here for a while, maybe watched the video, maybe even liked and subscribed, I appreciate you. So I need you guys to hang on today. Today's message may meet some of you where you are, and maybe some of you may end up having to come back to this at some later point. So I want to talk to you about your prostate cancer diagnosis, and then your subsequent prostatectomy or radical prostatectomy. And then I want to talk to you about your significant other. So in numerous cases, I've talked about in videos where your significant other is of value. I've even mentioned how valuable mine was in regards to my my subsequent recovery in this process. But I want to make sure that I pass along to you all that you need to be careful. All right, so you can talk to your significant other about what's going on with you, and I'm sure that they're going to ask and want you to do that. I would say to you, do not lean on your significant other because they may break. Now, the reason that I'm saying that to you is because you are a man, and your significant other person is not equipped to handle your emotional weight. I mean, they never had to. They never had to handle you being outright fully emotional about something, and over a continuous basis. And they've never probably been used to you complaining about something or feeling as though there was something that you couldn't fix. And of course, with the prostate cancer, some of the stuff is out of our control, but at the same time, the more you lean on your significant other, the more you are close to them clicking into mommy mode, right? Them taking care of you. Now, I mentioned in the videos that my wife and she was amazing, right? She helped a lot. She gave me baths in some cases and helped with the catheter and making sure that all of that was straight. But as soon as I was able to, all of that had to stop. Because the thing is that it was very important to me that she saw me as her husband, the man that she was attracted to, the man that she, wanted to build a family with. I needed her to see me as that, because that's what I needed from her. I needed hot to trot. I needed that chase thing. I needed that motivation to get myself up and to keep moving. And I couldn't do that while leaning on her and asking her to hold me up as I went through this process. Look, they're watching you, fellas. They're watching you. In some cases, some women won't agree with me, but maybe some of them are watching this to see what this would be like if it was them. Like, how would you handle this? Like, what does your emotional ability in these type of circumstances really look like? You're sitting there and you're looking, you're like, listen, she's never seen it before. This is one of those things like, I wonder how he'd deal with an emergency. Well, this is a big emergency. And now all of a sudden, she finally gets to see how it is that you handle these things. So you need to make sure that you get yourself to a point where you feel comfortable dealing with this yourself. I made another video about getting somebody to talk to and finding someone to share this information with. And, it's hard sometimes, but you just need to make sure that you have an outlet, but also that you are not making your partner your outlet. It's just not a smart thing to do. I know that a lot of guys will, well, my wife, she's awesome. I know she is. My wife is awesome. But I am not leaning all the way on my wife, trying to have her make me feel better, looking for validation. That's not what's happening. And I'm not even sure where this video came from, to be honest with you. I mean, it's a little hotter in the car than normal, so you probably will see some sweat because I had to get this out. And I know that this is meant for at least one of you. So hopefully you will get this message. Because the thing is that I've mentioned a number of things in the video. Like, one of the things that I mentioned in the video is that, you need to stimulate your penis as early as possible after the catheter's out and you're cleared. I said, then, you need to remind your body that you want to use that. Well, here's the thing. I said in the video that you should get your significant other to help you, right? But should you? I want you to think about that for a second. So you are frustrated because maybe you're having erectile dysfunction. Maybe your penis is not working at all. And all of a sudden, you have brought your significant other in to that circumstance. Now you've introduced into your relationship frustration about your penis not getting hard, when in essence, it's probably already an unsaid thing that's happening in your house that is now something that is said. They're going to want to help, but you need to get to a place where you understand what's going on. Now, why am I saying that to you? Because if they really want to help, what you can do is, there are other ways to sexually satisfy your wife. And as such, you need to get on the job. You see, that stimulation and those type of things is exactly what it is that you need. And that may be what they need. And so you can make sure that you are doing that, and what you're going to introduce into your relationship is intimacy. This is not a relationship dating thing, but there are a lot of guys who are out here who are losing their significant others and aren't strong enough to deal with this, and they're making really poor choices in regards to this, because they can't really deal with the fact that they have incontinence. They can't really deal with the fact that they have erectile dysfunction, and they're making really poor choices that are impacting their families. And so, I'm making this video for them. I'm making this video for most of you, right? The thing is that how your significant other sees you is important to you. And so you need to make sure that they see you as the alpha man, head of their family, and not necessarily as some guy who's going through prostate cancer who is woe is me. That's just my take. It's just my take. I had that conversation one time, my wife and I was sitting there telling her, one time she agreed with this lady who says, yeah, having a husband is like having another kid. And she was like, yeah. And I was like, oh. No, don't do that. I can't even have you fix your mind to do that, because I don't want you to ever look at me as somebody in the house that you have to care for. I'm grown. Before we got married, I took care of myself, and I can take care of myself now. So the thing is that we're adding to one another and bringing together. And so your prostate cancer is going to be something that is happening to you, right? It's happening to you, but you can control it. You can control at least how you see it. And so as you go through your recovery, you get to the place where you have recovered in your brain, and then bring in your significant other. Let them see you as the man that you are. I hope this finds you well. I hope this helps whoever this is meant for. Peace and blessings, fellas.